My mother was a nurse, my grandmother was a nurse, and it was kind of expected that I would be a nurse too. So I said, nope, I'm gonna do anything but be a nurse. I got a job as a secretary. I did a lot of traveling in that job, and I realized in short order that Prince Charming probably was not gonna come swoop me off my feet and give me a life of luxury, that I really ought to think about how am I gonna make a living for me. And I recalled something that my mother told me. I was raised as a child of a government contractor, and we moved every year to a different state, different country. Sometimes we were overseas. In all the travels that we did, my mother said, if you're a nurse, you can get a job anywhere. And I thought, that sounds pretty good. I applied to LSU. The school was going to open a co-ed dorm. It would give me a place to live. New Orleans seemed like an interesting place. Kind of all the not right reasons, but they worked out. You graduate from nursing school, and that's really just your ticket to begin to learn about nursing. You're making a commitment to lifelong learning. And that's kind of how I have viewed my career. I consider myself to have had 3 unique and distinct careers in nursing. Being a staff nurse at the VA, that's when I met my director of nursing, Madge McGregor, who must have seen something in me that I'm not sure I saw. I spent a lot of time in her office because I got written up a lot. I didn't understand rules and regulations that were written in Washington, D.C. I worked 3 to 11 at the VA hospital in New Orleans. How did those people know what my issues were? She also was the person who said, you really ought to think about going to graduate school. And I'd say, oh no, Ms. McGregor, no. I'm not graduate school material. She bugged me to death. So I applied to UAB. I did finish graduate school and was offered a position at UAB Hospital. Then I had my life in nursing administration. I always put patients first and nurses next, and the budget third, because I felt like as a nurse, my obligation was to patient care first. But you can't have good patient care if you don't have good nurses. And you don't have good nurses if you don't support your nurses. If you're taking care of them, they are taking care of the patients, and they'll do a good job. Then I had this wonderful job doing Medicare fraud and abuse investigative work. It was so satisfying to find someone who was harming patients and see them prosecuted and go to jail. And I thought, that's a whole new part of me. I never knew that I liked going after bad guys, but I did. I loved it. I have always tried to find people that I admire and respect. Find people who were better than me, smarter than me, and could I emulate them? Could I learn from them? And all of those people, because they were reaching out and helping, those were traits and characteristics that resonated with me that I wanted to pass on to others. I've always thought in my career I was not so much interested in the statistics as much as I was in the people. If there are people that I've influenced that have some of my passions for do the right thing for your patient at the right time, no matter what, then I've been successful. it's the stone in the pond, and you don't know where the ripples will go.